If your heart suddenly feels like it's racing, fluttering, or skipping, and you realize you haven't had much to drink, that connection is real. Dehydration can make palpitations more likely, even in otherwise healthy people. The key is that your heart isn't acting randomly, it's responding to changes in blood volume, salts, and stress signals. When fluid levels drop, your body has to work harder to keep blood pressure and oxygen delivery steady. That extra workload can show up as a fast pulse or an irregular feeling beat. And if you're also sweating, sick, or drinking a lot of caffeine, the effect can stack quickly. The goal here is to explain the main mechanisms in plain language, so you can recognize what's happening. We'll also cover common triggers that quietly worsen dehydration. And we'll finish with practical, low-risk steps and red flags that mean you should get checked. Moving to slide 2. First, let's define palpitations. Palpitations are the sensation of your heartbeat. Too fast, too strong, irregular, or just noticeable. Sometimes it's a normal increase in rate, like a steady, rapid beat. Other times it feels like a pause, a thump, or a flutter, which can be extra beats. The feeling can be scary, but it doesn't automatically mean something dangerous is happening. What matters is the pattern, the context, and your symptoms with it. Dehydration is a common context because it affects the basic conditions your heart relies on to beat smoothly. Think of your heart as an engine, and your blood as the fluid that keeps pressure and flow stable. When that fluid level drops, the system becomes more sensitive. Small changes in posture, breathing, or exertion can suddenly feel dramatic. That's why palpitations often show up when you stand up, walk upstairs, or try to exercise while underhydrated. Moving to slide 3. A major driver is lower blood volume. When you're dehydrated, you have less fluid circulating in your bloodstream. With less volume, your body can struggle to maintain blood pressure, especially when you change position. To compensate, your nervous system tells your heart to beat faster and sometimes more forcefully. That faster rate can feel like palpitations, even if the rhythm is technically normal. This is why you might notice your pulse jump when you stand up after sitting. It's also why dehydration can make you feel lightheaded or a bit shaky. Your brain is sensitive to drops in blood flow. Your blood vessels also tighten to help maintain pressure, which adds more work for the heart. In simple terms, dehydration shrinks the tank, so the pump has to speed up. For many people, rehydration and rest settle this quickly, but if the volume drop is large, symptoms can be intense. Moving to slide 4. The next piece is electrolytes, especially sodium and potassium. Electrolytes are charged minerals that help your heart's electrical system fire in a coordinated way. When you sweat a lot, have vomiting or diarrhea, or drink only plain water after heavy salt loss, those levels can shift. Even mild imbalances can make the heart more irritable, meaning extra beats are more likely. Potassium is important for resetting heart cells between beats. Sodium helps regulate fluid balance and nerve signaling. Magnesium also plays a supporting role in stabilizing electrical activity. Dehydration often isn't just water loss, it's water plus minerals. That's why some people feel worse when they chug water quickly but don't replace electrolytes after prolonged sweating. The goal isn't to megadose supplements. It's to understand that the rhythm of the heart depends on chemistry as well as hydration. If palpitations show up after heavy sweating, electrolytes are a prime suspect. Moving to slide 5. Dehydration also activates your stress response. When your body senses low volume or low pressure, it releases adrenaline-like hormones to keep you functioning. These signals increase heart rate and make the heart beat more strongly. They also make you more aware of your heartbeat, so you feel every thump. This can create a loop. You notice the palpitations, you get anxious, and anxiety adds even more adrenaline. Even if the underlying rhythm is not dangerous, the sensation can intensify quickly. This is one reason palpitations often come with sweaty palms, a sense of urgency, or a tight chest feeling that's more nervous system than heart muscle. Dehydration can also worsen sleep and raise baseline stress, which lowers your threshold for palpitations the next day. The important point is that stress hormones are not a moral failing. They're a built-in survival system, but when you're underhydrated, that system turns up the volume. Moving to slide 6. Another mechanism is thicker blood and reduced heat control. With less fluid, blood becomes more concentrated, and your body has a harder time cooling itself. If you're hot or exercising, your heart has to push blood to the skin to release heat, while also supporting muscles and organs. Dehydration makes that balancing act harder, so heart rate climbs. This is why palpitations often appear during heat exposure, long walks, or workouts when you didn't drink enough. You might also notice more shortness of breath for the same effort, because your cardiovascular system is working less efficiently. Add humidity, and sweating becomes less effective, which can further raise strain. None of this requires a heart disease diagnosis to happen. It's basic physiology under stress. The takeaway is that heat plus dehydration is a common recipe for a pounding, fast heartbeat. If you're prone to this, planning hydration around heat and activity matters a lot. Moving to slide 7. Let's talk about common silent dehydration triggers that also cause palpitations. Caffeine can be a double hit. It can mildly increase urine output in some people, and it also stimulates the nervous system. Alcohol is another big one, because it promotes fluid loss and can disturb sleep, both of which raise palpitations risk. High-sugar drinks can pull water into the gut and leave you feeling thirsty again, especially if you're already depleted. Some people undereat when stressed or busy, and that reduces sodium intake, which can worsen low-volume symptoms. Long flights, heated indoor air, and cold weather can also dry you out without obvious sweating. Even certain diets that are very low in carbs can cause early water and sodium loss. The point isn't that these things are bad, it's that they change your hydration baseline. If palpitations happen on days with coffee, alcohol, or travel, the pattern may be telling you something useful. Moving to slide 8, there's also a posture and circulation angle called orthostatic intolerance. When you stand, gravity pulls blood toward your legs. Normally, your vessels tighten and your heart adjusts smoothly. With dehydration, that compensation can overshoot. Your heart rate may jump quickly, and you feel pounding or fluttering. Some people also get a brief dimming of vision or a whoosh in the ears. This can resemble patterns seen in conditions like POTS, but dehydration alone can mimic parts of it. The practical clue is timing. Symptoms appear within a minute or two of standing, and improve when you sit or lie down. If you're noticing this, it's a sign your volume is low or your electrolytes are off. It's also a reason to be cautious with sudden posture changes when you're underhydrated. Standing up slowly and rehydrating steadily can reduce the intensity. If it's frequent or severe, it's worth discussing with a clinician. Moving to slide 9. Now, what do dehydration palpitations typically feel like compared with other causes? Often, they come with thirst, dry mouth, darker urine, headache, or fatigue. The heartbeat is commonly fast and steady, especially with movement, heat, or standing. You may also feel better after drinking fluids and resting for a bit, though it's not always instant. In contrast, palpitations from some rhythm problems can appear out of nowhere at rest, last longer, or feel very irregular. That said, sensations overlap, so you can't diagnose rhythm type by feeling alone. It's more about the whole picture. If palpitations only happen when you're clearly underhydrated and they settle with hydration, that's reassuring. If they happen with chest pain, fainting, or significant shortness of breath, that's different. Another clue is frequency. Occasional episodes tied to heat or missed fluids are common. Daily episodes without a clear trigger deserve a closer look. Moving to slide 10. Certain people are more vulnerable to palpitations when dehydrated. Endurance exercisers and outdoor workers lose both water and salt through sweat. People with frequent stomach bugs, reflux vomiting, or chronic diarrhea can lose electrolytes quickly. Older adults may have a weaker thirst signal and can get behind on fluids without noticing. Pregnancy increases blood volume demands and can make heart sensations more noticeable. People with anemia may feel a faster heartbeat sooner because oxygen delivery is already challenged. Thyroid overactivity and some stimulant medications can also lower the threshold for palpitations, so dehydration becomes the spark. Even if you're generally healthy, a combination day, poor sleep, lots of coffee, a salty sweat workout, and not enough water can push you over the edge. The useful move is to identify your personal risk stack. When you know your triggers, you can prevent many episodes with simple planning. And if you're in a higher risk group, it's smart to be more cautious during heat and illness. Moving to slide 11. So what can you do in the moment in a safe, common-sense way? First, stop and reduce exertion, especially if you're hot. Sip fluid steadily, rather than chugging a huge amount at once, which can upset your stomach. If you've been sweating a lot or had diarrhea, consider fluids that include electrolytes, or pair water with a salty snack, unless you've been told to restrict salt. Cooling down helps too. Shade, a fan, or a cooler room reduces the workload on your heart. Slow breathing can also blunt the adrenaline surge and make the sensation less intense. Then reassess. Is your heart rate settling over 10 to 30 minutes? And are you feeling clearer and steadier? If yes, that fits the dehydration pattern. If not, or if symptoms are escalating, it's a sign to take it more seriously. The goal is stabilization, not forcing yourself to push through. Moving to slide 12. Let's cover red flags, because palpitations are sometimes a sign of something that needs urgent evaluation. Seek medical help promptly if palpitations come with chest pressure, fainting, or near fainting. Also, take it seriously if you have severe shortness of breath, new confusion, or one-sided weakness. A very fast heart rate that doesn't slow with rest and hydration is another warning sign. If you have known heart disease, a history of abnormal rhythms, or you're at risk for blood clots, don't assume it's just dehydration. Ongoing vomiting or diarrhea can also become dangerous because electrolyte losses can accelerate. And if you're unable to keep fluids down, dehydration can worsen quickly. The point of these red flags isn't to scare you. It's to give you a clear line between common physiology and situations where it's safer to get checked. When in doubt, especially with severe symptoms, err on the side of evaluation. Moving to slide 13. For prevention, think in terms of a daily baseline and a high-loss plan. Baseline means you drink regularly enough that your urine is usually pale yellow, and you're not relying on thirst alone. High-loss plan means you adjust for heat, exercise, sauna time, or illness. If you're sweating heavily, replacing some sodium along with water often helps maintain volume, because sodium helps you hold onto fluid. Spacing fluids through the day is usually easier on your body than large boluses. Also, watch the combo triggers. Alcohol plus heat, or coffee plus a long workout, or a salty sweat session with only plain water afterward. If you track anything, track patterns. When palpitations happen, what you ate and drank, sleep, and stress. That information is useful for you and for a clinician if you need one. If palpitations are frequent, an ECG or a wearable rhythm recording can sometimes clarify what you're feeling. And that can be reassuring, even when the answer is dehydration plus stress. Moving to slide 14. Let's wrap it up with the simple model. Dehydration can cause palpitations because your blood volume drops, electrolytes shift, and stress hormones rise. Heat and posture changes then magnify the effect, so you feel a racing or pounding heart. Most of the time, the pattern is predictable. It shows up when you're depleted, and it eases when you cool down and rehydrate steadily. The most helpful skill is noticing your personal trigger stack: sweat, caffeine, alcohol, illness, poor sleep, and intervening early. Now I'm curious about your experience. Do your palpitations happen more with A, heat and exercise, or B, stress and caffeine? Put A or B in the comments. If you want more clear physiology-based explanations like this, subscribe. This information is not a substitute for medical